textbook versus experience when it comes to rheumatology diagnoses. Hello, this is Dr. Siddharth Dambar, board certified, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. Comment that I saw on one of our social media channels is the challenge that some folks have, some patients have when it comes to diagnosis from rheumatology and whether or not they fit into a textbook description, and how sometimes less experienced physicians may not be able to find a diagnosis if a person doesn't fit that textbook diagnostic criteria. So for autoimmune conditions, there are some very strict textbook criteria to make these diagnoses. Now, for most of these conditions, there's a little bit of leeway. It's not as though, hey, there's only one set of criteria, and if you have that, that's great. For most autoimmune conditions, it may be, look, here's 3 to 11 different criteria, and do you meet several of them to give you a diagnosis? So there's a little bit of wiggle room there. And the reason why is because people do present in different sort of ways. Not everybody presents with their autoimmune condition in that exact same way every single time. So in the textbook criteria, there is some leeway for really all of these autoimmune diagnoses. Now, the reality is that there are some folks who don't even quite meet the textbook criteria. Then your experienced rheumatologist has to make a judgment call whether you may be someone that has a milder version of an autoimmune condition, whether you have a condition and we just don't quite have enough criteria, but you're close to it. You may be someone that's in that kind of gray zone. And frankly, rheumatologists actually have names for those kind of diagnoses as well. For example, maybe you don't meet full criteria for lupus or Sjogren's. Well, for rheumatologists, we have a diagnostic criteria called undifferentiated connective tissue disorder, which means, okay, you don't quite meet specific criteria, but you're in the mix. Or let's say you have classic exam findings of rheumatoid arthritis, but you're negative with antibodies. Well, we may call it seronegative rheumatoid arthritis, although more and more we'll just call it rheumatoid arthritis. Or you may have, let's say you have classic inflammatory back pain symptoms, but your imaging is not quite there, but your overall history is there, meaning classic symptoms, some examination findings, maybe you had some other features or family history that fits that criteria as well. Well, we would then call that non-radiographic spondyloarthropathy, which means you've had inflammation in the spine, but your imaging is not quite there. So rheumatologists do have leeway with some of these diagnoses because we recognize that not everybody fits textbook in terms of diagnostic criteria. But with that said, your physician should be experienced, should feel comfortable making some of these decisions with you. And sometimes it may seem a little bit in the gray zone, but if your rheumatologist knows what they're doing, they should be able to function in that gray zone. They should be able to sense when your symptoms fit, but maybe some of your objective criteria in terms of labs or imaging don't, but maybe you've got some other features that do. And how are you responding to either traditional treatments that we would use for inflammation, or have you ruled out other conditions as well? And if you do that, then experience can come into play to help bridge that gap between textbook and sometimes a little bit of ambiguity and gray zone. Hope that helps, and hope you're able to get the help that you need if you're symptomatic and if you are suffering.